I'm Jackline Atino. I've been a nurse since I was born, if I may say so, but licensed from 2019 to date. But currently I'm licensed as an ICU nurse and I work at Healthgate Hospital. Yeah, to be an ICU nurse entails a lot. First of all, you have to have qualified for the Kenya Registered Community Health Nurse. That's a 3.5-year program at KMTC or any other private facility. And then you have to go back again to school to specialize in critical care patients for a year for you to have been certified. To get the certification as an ICU nurse, you have to go back for 1 year, you study, so you come back to work in the ICU. When I was young, issues to do with playing with dolls and looking after your younger siblings. In my family, we are many of us. There are more people behind me. So when my mom could leave us at home, I used to really care for my younger siblings, and they loved it when I'm with them. So when they were sick, or my doll playing a sick doll, I used to care a lot. So usually they nicknamed me a nurse in Trinidad when I was young. So I was like, where is Trinidad? Why am I a nurse in Trinidad? Then they were explaining to me how I was behaving like a nurse, how nurses work. Back in the days, how nurses were perceived, white clothes and what. So that's when I started just living in that, knowing that, I'm behaving like a nurse. So probably it's in me. It's not something that I'll do it maybe for financial gain or for just to satisfy my parents' needs of me becoming a nurse, but it was something that was inborn that started to manifest since I was a child. I can say exciting, and I'm fascinated about it. Being a nurse, I can say I'm proud. I'm a proud one because the journey is not easy. Somebody telling you that I'm from nursing school and I'm a certified nurse, licensed by the Nursing Council of Kenya. It's not an easy thing. You can see us in the blue uniforms as we are going to school. Some may tag us funny names or may look at you like you're just an MTC student or a college student, you're not in the university. But trust you me, we put a lot of work to study those books, miles, A&P, those medical surgical books. You have to read a lot. Most people drop, by the way. They leave them. They don't want to work with it at all. But for us that managed to scrub through the book, all the nitty-gritties to become a nurse, it was a tough time, a hard hill to climb, but at the end of it, we managed that, so you can say we are proud to be nurses. Nursing. It's a hard thing if you focus on it as hard, but it's doable when you are in it and you are for it. In the morning you come, it's just like you yourself, because we do cares for the patient. It's in the morning you wake up, what's your routine? Each and every day, what's your routine? So usually you find that different hospitals have different routines each and every day, how you're supposed to, at this time I'm supposed to have done this, at this time should have done that. So in the morning you come, you check your patients, you freshen them. Like you can just say, hi, today I'm your nurse, I'm called Jackline, I'm going to be with you for the whole of the day, and this is what you're going to do. Any challenges? How are you feeling? How was your night? You see? Then so that you can make at least your relationship with the patient to be good, so that they know you. I've worked actually in the ICU for now 2 years, and my toughest time is usually when a patient signs a DNR form. It's a Do Not Resuscitate. Like to resuscitate just to try to save a life. The CPR. So when the immediate family signs that, that's my worst moment, because now I'll just be like saying, yes, I'll be providing my cares, I'll do everything for the patient, but the fact that when the patient is shutting down, I'll not be able to do anything. I'll just be looking, just giving comfort, just making sure the patient is pain-free, making sure the patient is okay, but not intervening.
Yes? Saving them.
Yes. Now it's like your hands are folded, but in a medical way. That's the DNR form. Usually they sign it when the prognosis is not good. Yeah, when they just want the patient to, yeah, maybe they have had a long time in the hospital, so they want him or her to just rest. So you ensure the patient is pain-free, but you just give all other cares, you feed, everything. But you can't do anything when you see the heart is going down, the breaths are going down. Usually it's hard for me. That's those instances, I don't like them. No, you don't cry. Usually you don't cry because you ensure you don't have attachment like that, too much attachment with the patient, that because when you cry there is also another one waiting for you. Will you be going with red eyes? Or because yes, it hurts and you can cry, but not somebody seeing you crying. You can feel it because you're human actually. So you just do your best, but it's the toughest situation I've been meeting mostly. A lot. Not 50. It has not gotten to 50. You can say 20, 10. But this one that I did looked so small, but later on I came to realize that it was not as small as I thought it was. There was this woman at a facility that I started working immediately after finishing my basic, that is KRCHN. And I was working at a clinic, usually at where we give babies injection, MCH, that's maternal child health. So these injections, the baby comes for BCG at birth, then 6 weeks, 10 weeks, 14, that one. So this mom came. She was just like a middle class person, or I can say lower than middle. She came with the baby, carrying the baby. The baby was febrile, like temperatures were high, up to 39. Then she came, since it was a private facility, she went and saw the doctor after me giving the first aid to make sure the baby's temperatures go down. So the baby was a bit cool, and then she went to the doctor. Then on checking the baby was just 15 weeks old. The doctor saw the cord. It was infected. Cord. And then she was told to pay a certain amount of money so that the cord can be cleaned and everything done, now in the hospital. Then she could be discharged home. So she came back to me after seeing the doctor, and then she told me, I've been told to pay this amount of money so that the baby's cord can be cleaned and what. But I don't have that money. She resided then at Kawangware. So she told me, I only have like 50 shillings to take me back home with the baby. I just looked at her. Just by assessing her, you can see actually she needed help. But now she has also to do what to pay. So she told me, let me just go. Then when I find the money, then I come back. I asked her, do you have any public facility nearby? She said, yes, but she just trusts that place because that's where she gave birth to the baby. And then she's been bringing the children there for the immunization and so on. So I decided to take the baby. I just did a very nice dressing. The cord, I cleaned it so well. I went and took the nini, dressed it without even any medications. I made sure it was about to fall. It took a long time before it fell. So I just cleaned it so well. It was very dirty. I asked her, do you usually do the cleaning and what so on? She told me yes, but with something else, these herbal things, but now infection was getting in through the cord because she was using those herbs. So I cleaned it and till it was okay. Then I told her, the way you were told to be cleaning the first time you gave birth, before you started using these other things, just go and do the same. So she went. And after like 2 weeks, she called. She never came back. I thought maybe she could come for review and what. She called me. Sister, how are you? I told her I'm fine. Do you know that the baby is doing well? I told her, oh, that's nice. Now even I didn't know that was her. But I usually, when I was working in the clinic, I just used to give my number. In case of anything with the baby, you can call. Then I tell you to come to the facility. She was so happy. She sent me 100 shillings. Oh, wow. You know how I was like, I don't want to say her name, but the lady that was something coming deep from her heart. I had helped her. After 5 years down the line, she still calls me. Do you remember me? Who are you? I'm the mom that you helped. You cleaned the baby's cord. I didn't have to pay that money. The baby is okay. The baby has never been infected. I just love you. Usually just call you to say hi. Every time she calls, just to say thank you. You see? Just to say thank you, because I stepped in a time, when you have a small baby and then baby sick, someone who can't say I'm feeling here or back or headache, and I just stepped in and helped the mama. She's usually grateful to date. She calls each and every day. So I saw it as a small thing. I just did it, and because we usually teach them how. So I was telling her, first they cleaned, then I showed her the way to do it, then I explained. The way you were told the first time, do it. I'm quite grateful till to date. So that keeps me going. I'm saying like each and every day you meet a different person, a person with a different need. You sort out their need irrespective of who they are or what they are. But since you've touched somebody in a different way and they're grateful for that, that one keeps me going each and every day. Those are things that actually matter a lot to nurses. Nurse-patient ratio, usually every facility has its policy. You can find there is 1 to 10, you can find 1 to 8, 1 to 6, 1 to 5. It just depends with the facility that you're working at. That's why it's private. It has to be 1 and below 5. And that's maybe better, I can say maybe better, because private facilities have demanding patients. Most nurses, they're overwhelmed, regardless of the patient ratio, nurse-patient ratio, because also it depends with the patient's condition, it depends with the patient's understanding, it depends with the patient's needs. So a lot of things revolves around the patient mostly. The nurse, we know you can't have one. Only in the ICU you have 1-to-1, because in the ICU now it's you are the one living for the patient, to turn, to feed, just to raise their fingers, their hands, to make sure they're okay. You are there doing everything for them. But in the wards also, it just depends on the patient. So you find most nurses, they get overwhelmed. But losing their cool, I can say yes, because actually it's overwhelming. We care for a person, not 1, not 2, not 3, not 4, not 5, not 6. You care for a lot of people. I can be here, but my mind is like I have like 5 patients or 6 somewhere that are waiting for me. And whatever they're counting on me is something dire that should not miss. So most of the times you'll find us losing it. But for my sake, I've ever lost it, yes, as a nurse. I had a patient somewhere and then they were like, this line is painful, the drug, but you can see everything the way you were taught and the way you know with our assessments and everything, you can see that everything is fine. But now the person is just becoming too much demanding, like all this, all that. Things that are not related to what you're doing to them. Like just trying to catch your attention. It's like they're throwing tantrums. In such a case, what I did, I just had to step back. I went to my immediate supervisor. I explained the scenario. Then I told her, I can't work with this patient because of 1, 2, 3. Kindly bring in another person to step in on my case so that I can go back. That's what most at times we do. So instead of letting it getting to a point that somebody is going to hurt you, it will be better if you just step back. Yes, like I can say, there's a time I came, I left a sick baby at home. You know, you are there, but your mind is like also somewhere. You're imagining what's happening to the baby. Yes, I took him to the hospital the other day. He's getting better. He's able to be left by somebody. But you know, there's somehow you'll feel as a mother, you're also having somebody sick there, but you're here to care. You shouldn't let that patient know that there is something going on. Don't let the patient ask, are you okay? No. Dealing with it is hard because you're supposed to like keep it at the back of your mind when you are working. But what I can say, what keeps me going as a nurse, knowing that I have my issues that I'm not supposed to display to the patient, is that I know, as a saved person as well, that God takes care of his people. And when I care for this person right, something bad won't happen. Things will just fall in place. Maybe you come, you had bad issues at home, maybe you've lost your loved one, maybe you're just from maybe burying them, and then you're back. You'll be like, God will just see me through this. But now when you channel the emotions differently, the same emotions you have, you can channel them in a different way to give you positive results. You say you are hurt, then just say, let me just care for this person so that maybe they may not feel hurt, because when I feel hurt, this is what I feel. But when they feel hurt, will they also feel the same? So let me help them so that they don't get hurt. So you'll see, you will find yourself just tuning your mind to helping this person, helping, caring, not let anything bad happen, not imagining. And then time just flies. It's evening, then I just go home. But since you have cared for this patient, you just channel it back to care. That's what I usually do. I say, let me care for this kid as my own. Then God won't let something bad happen to my own. Let me dress this patient. Let me do everything to this patient as if I'm doing it to myself, as if I'm doing it to my mother, to my father. Then you also ask yourself, if the same is done to your person, how will you feel? Because some of us will lose loved ones in different hospitals. Then we say maybe it's negligence, or the nurse didn't do this, the nurse did this. Let's say, for example, it's my mother or my parent. Then somebody does the same. Will it sound good to you? How will it augur to you? So you have to put yourself in their shoes. Then psychologically, you'll just find yourself synchronizing well with the patient and doing the right thing at the right time for the patient. And then I know you've heard the saying that people say that nurses, they don't have a life outside here, which is also true. You can find some in the private sectors. We report to duty maybe 7:30 or 8 to again 7:30 at night, or 8, or sometimes 7:30 to 6:30. It depends with the facility, right? So you see, your whole day is gone, compared to people that are working, like the public. They work from maybe in the morning 6:30 to 1:30, then 1:30 to 8, then the night. You see, so it's three shifts for the public, then 2 shifts for the private. So you find it hard for you to get maybe a nurse outside there doing, maybe going about her duties normally, because that time is not there. You get time to rest that back won't allow you to go maybe and do something else somewhere. You'll just find time for your kids. That time you just, in fact, it is allocated. You say, on Monday I'm off, yeah, this Monday I'm going to do this, and that. Tuesday I'm back to work. So you find yourself always on your toes. Every time you're just geared to something. You don't have any free time for you just to relax or to without worrying. So that's why you find even most nurses, they go to depression actually, mostly the introvert ones. But most importantly, may I appreciate the facility I work in, because usually they give us an ear. The management, they listen to our pleas, at least they address them. And so far I've never seen depression or anything to do with drug use in my facility where currently I'm working at. What I can tell them is eat right, exercise, laugh, and we don't want you to get sick. Yeah, you don't want each and every time you're sick. If it's a sickness that you can avoid it. If it's something inevitable, then well and good. But in case you find yourself being my patient, just be nice. Yeah, just be nice. The way you want me to be to you is the way even me want you to come to me. You come to me rightly, I'll reciprocate. You know what? Whatever you give is whatever you receive. Like just the law of the earth. Whatever you give Mother Earth, it will bounce back to you. But with us, it does not apply to us. You give us your bad side, we just give you the good side, which is energy. You are drawing a lot of energy from us. That's why you find us look a bit tired, and it's morning, and you've just reported to work. And you're tired because you're giving us negativity, but we just give you positivity. So let guys not drain us out with the way you talk, maybe with your mannerism, with the way you respond. Okay, so that also us, when we give, you know, gratitude is like electricity, if I can say. It has to be produced for it to be supplied, and then to be used up again, it gets produced. No. So each and every time you have to give us something good, so that we use that goodness, your gratitude. There's a way it makes a fire to be produced in us. A lot of it. When you come say, hey, thank you, I feel like, yeah, so I've done something good. Then there is another fire for the next person. But when you pour water on it, what will the next person get? So as we do good, we also appreciate it when people also bring positivity.